Hi, I'm Donald Sloss, and I'd like to take a couple of minutes just to talk to you about treating anxious dental patients. For me, one of the fantastic things about dentistry is the different attributes dentists have and the different things people like doing. For instance, some people love treating children, endodontics, periodontics, not really my kind of thing. But I actually love treating anxious patients. I know it might sound daft to some of you, think the last thing I want to see is an anxious patient, but I love the challenge of sitting down with them and finding out what makes them tick and what we need to do to overcome that anxiety, and then seeing the fantastic change in their lives afterwards when we've got them all sorted. So we've developed a team here at Harewood. I've got my skill set with treating anxious patients, and that can range from anything from gentle injection technique through to intravenous sedation and everything in between. But also we've got Eli Madden, who's an expert in laser dentistry, and lasers now can carry out treatment without any local anaesthetic in some instances. So for needle phobics, absolutely perfect. And we've got Howard Samuels on the team as well, and Howard's got diplomas in psychology and hypnosis, and he can sit down and work through cognitive behaviour therapies, hypnosis, give the patients coping strategies. The overall aim is not just to carry out the actual treatment for the patient, but to treat them in a way that they're very happy to come back for future treatment, and that eliminates all the long-term problems. So if you're sitting in your practice thinking, I've got an anxious patient coming in today and I really don't want to spend the time on them, I haven't got the time because of the situation I'm working in, then we would be delighted to take these patients from you, free up your time to crack on and treat patients are easier to carry out your treatment on, less stressful, and we can have the enjoyable challenge of working out how best to cope with these patients. It can be anything from just minor anxieties or a particular difficult treatment through to the worst fears, and believe me, I've seen an awful lot of very, very anxious patients, but after a bit of detective work we get there in the end. So if we can be of help to you, the contact details will be coming up in a wee minute. Be delighted to receive any referrals from you. Just let us know what you want us to do for you, whether it's just a specific treatment or whether it's just to take over the overall care of the patient. Not a problem at all, whatever you want, and we'll look after your patients. Thank you very much.